Good evening. Welcome to the Emergency Services Board. Today's date is February 10th, 2021. I am Gary Bell. I am a member of this board. I'm a member at large with the Fire Board Association. I'd like to introduce the board members with us tonight. C.P. Budinsky, our County Fire Chief, St. Mary's County Fire Board Association. John Nelson, President, St. Mary's County Fire Board Association. Sean Davidson, our County EMS Chief and also Secretary of the ESB. Carol Bohm, President of the St. Mary's County Rescue Association. Hattie Norris is the member at large for the Rescue Association. Mr. Steve Walker, Director of Emergency Services. Dr. Dan Geary, our Jurisdictional Medical Director for St. Mary's County. Ms. Amy Carter, our videographer. Seated at the end is Mary Ann Gardner, our Emergency Services Office Manager, and Darlene Mund is in the front row. Some announcements tonight. Please turn your cell phone off or on vibrate. And also keep in mind that this meeting is being televised, so if you need to speak, speak clearly and directly into the microphone for recording purposes. With that, we'll move on to our agenda. First is our review and approval of minutes. Is there any questions on the minutes that were sent out? If not, we'll entertain a...
Make a motion to accept the minutes.
All right, a motion by CP. Is there a second?
Second.
Second by JA. All those for approval? All those say yay?
Aye.
All right. All right, moving along, we'll move into our presentation, which is the overview of the Department of Emergency Services fiscal year 22 budget request.
Okay, so we're going to go through, you're going to see a lot of what you've seen previously. Very similar presentation with a few changes. So go to the next slide. Okay, St. Mary's County Emergency Services, what does it comprise of? 5 divisions: emergency management, animal control, which you see in red is now shelter. So we'll talk about that in a little bit, but that is now in the design stages, and it'll come up here in about a year and a half. 911 communications. Next is our EMS operations. That's still proposed while we're kind of in the building stages of that, but it is now a department. And then how far it gets built and all that, that's for the future. Ready repair. We also have specialty functions, organizational training, accreditation services. Also responsible for the Emergency Services Board. We support these boards. Advanced life support, that's a pass-through, comes through our department to finance, fire and rescue under the 251 fund. Next slide. All right, emergency management and animal control. Again, that's the shelter. Animal control services. Animal control will come underneath the shelter when that opens, and we'll have a shelter manager. Animal wardens assigned to this division. Coordinates the activities of emergency medical services coordinator. Emergency medical services coordinator is Mr. Mark Pettit, and he does a whole multitude of duties and is extremely valuable to what we do. Emergency management coordination of all emergency services, disaster response activities in St. Mary's County. Of course, that's our emergency operations center, which we now are using that. We're coming up weekly to talk about COVID. Ensuring emergency management responses are in compliance with all federal, state, and local laws, regulations, policies. Mr. Gerald Gardner, emergency manager, does quite a good job of that. Oversees the activities of the hazardous materials response team in cooperation with the Fire Board Association, and we've had some really good movement with our new fire chief over here, so excited about what's going to come out of that. So we're starting to get some pretty good structure in that, and that's very nice. 911 emergency communications. Remember, when you call 911, that's where you're gonna end up at, is our dispatchers. Computer aided dispatch, which we're going to talk about that. We're going to have our new system up within the next year, we hope. 911 support of fire, rescue, sheriff's office response. All dispatchers, of course, are assigned to this unit. Emergency medical services. EMS division currently has 1 employee, and we're beginning to work towards career operations. Also under that right now, of course, is the contract services for supplementing the rescue squads. He is a liaison between career services and our volunteer community. And of course, we are currently providing the basic life support services to the rescue squads in a supplemental capacity. EMS operations, we bought some of these with grants. Next slide. We have 1 ambulance fully staffed, ready to go. We have been using it for standby at the vaccination sites, and we are now beginning to use it actually for calls for service when there simply isn't anybody else to respond. And what we're doing is we're pulling our employees that are EMT certified and able to put them on. We'll also have 2 EMS ALS vehicles. Chief Stamey drives 1. The other one is waiting for staff to fill it, which we're beginning to work on. There is a budget request for personnel to staff these vehicles continually and begin to contribute to the EMS services in the county in medic capacity. Radio repair, radio technical services, works with our radio vendor to ensure system functionality. Knock on wood, it's been functioning very well. Performs maintenance and repairs on system radios, installs radios in the county vehicles and first responder vehicles, and I'll be talking a bit more about that later on. Next slide. Okay, other areas of responsibility, 251 fund, that's Emergency Services Board, that is this sitting board. Advanced life support, again, that's a pass-through funding. The budget comes to us and we send it right to finance, and the money gets dispersed to them and they function independently. Of course, fire and rescue, very similar, where their budgets come in and then we send it to finance. There's some other components of that. Amos Fund, State 508, I'll be talking about that a little bit more. And then taxing services, fire tax, rescue tax, comes into finance and gets dispersed. Next one. Grants divisions, Emergency Number Service Board, which is now the 911 Board. That's changed their name. And that funds the operations of the 911 Center. MIMS grants, which is for EMS support. EMPG grant, that is through through Emergency Management. Of course, Homeland Security, MEMA. Pre-disaster mitigation federal grant. Those are all organizational grants from governmental agencies. Exelon, of course, is the big power plant, and they give us a grant every year to assist us with our operations, and it does help, and we see some impact from that. So, all right, specialty units, training function. Coordinates all training and certification for Department of Emergency Services, coordinates quality assurance activities, and coordinates community outreach. The training function is monumental, and of course our training coordinator, Jay Mattingly, does an outstanding job, but the amount of certifications required to be a dispatcher is incredible, and he, again, does an outstanding job. Quality assurance, we're still building that. We do some of it as we need to, but we're trying to work towards doing that on a regular basis to improve our community service. Community outreach, unfortunately, during COVID, there hasn't been much because we have been building that, and now this hits and we can't. This is when we go out into the community, educate people, make sure they're aware of what we can do, what we can't do, and it works well. Accreditation, that is building our agency in a standardized, structured way. That also has been impacted by COVID because of so many different duties we're being pulled away to do, but we are continuing to work on that. So all of our policies that are written are meeting accreditation standards, and it's an important function, but it's going to take a while to get there because of all the different things that are happening. All right, next up. Okay, so I don't know if you can see it very well. If you're at home, you could go into Board Docs and download this and you could see it. So we'll go over this. So in the big red letters across the top, requested. I can't say it enough. This is a budget request that has gone to the commissioners. And this changes daily. We have asked for quite a bit more, a lot of it because of planning, a lot of it because of new positions, a lot of it because of COVID. We're already hearing from the commissioners, there's not enough money. We're aware of that, but this is what we need to do what we got to do, but it is a request. But remember that as the budget goes in every year, there's negotiations on what is needed. There just isn't enough money to go around for every single thing that's asked for by department heads. It's the reality of it. But we ask for what we need. If we can't get it, we try to find other ways to do it. So let's go down. Fiscal year 2021, and this is this year, emergency management, $591,759. What we've requested this year is $739,389, increase of $147. So we've asked for a number of things to increase what we do. Part of that is staffing. Next one's animal control. Now remember, animal control at this juncture is not a part of the shelter, so their standalone fiscal year is $1,038,973. Goes up to $102,857, $63,000. Again, many of our increases are salary increases that occur every year. New animal shelter in fiscal 2021, you see there's nothing there. In operating, there is money in capital, but that's a different line item. That's for the building. First year is $246,174, and of course that's an increase. That amount, when you consider what we're doing, we expect, we hope, we pray that the shelter will be up in June of 2022. So that's 1 month's worth. So when we get into the next year, it's going to be substantially higher. So we're only doing 1/12 of that cost. And that's why that is really not as large as it will be. It'll go up considerably higher once we get into the entire year. There's 12 new positions in there. Those are all planned. Anywhere from shelter manager down to animal care to volunteer coordinator. There's a whole host of those. I expect that after we evaluate, we may find we need more than that, but that's a good starting point, and we had a staffing study done from a consultant.
Item is
and we're
lost.
pretty
There are no
close behind
replacements.
that. What was that? Was that Amy? Or was that somebody's radio?
That was not me.
Okay, so it's probably somebody's phone. Or was there somebody online that made a comment? Okay, emergency communications, $3,599,415, going up to $3,794,089. Again, much of that is salary increases. Radio communications, $1,343,749, going up to $1,488, and $144,000 increase. And then you see our totals there, $800,000 increase in that first part there. Other funds, you have your 251 fund going up $250,000. 251 fund, 38 XX 55. There's no change there. 251. Next one is 50,000. No change there. 252 fund, and this is the new division, emergency medical services. For our requested amount is $825,000. Requested, and I can't say that enough. Nothing has been approved. We won't know till April or May if we begin to get some of these requests. So as you see, if you just go right to the heart of it on the far right, it's just over $1 million increase.
Is it?
The 250, is that for the county hiring their own EMS?
Yes.
Okay.
Yes, that's correct. That's what that is. And I'm going to get into that a little bit more as we go on. So grants divisions, again, this is what Mr. Gardner handles predominantly for us. And again, if you look over $350,000 increase. Total increase request, 2.2 million. You know, realistically, a lot of requests. You know, do we have enough in the county? Well, that's for 5 commissioners to decide. Obviously, it's too large to cover every detail in the meeting. If you want some details, I'll be glad to give them to you. I guess that's really it. When you go down the list of the different positions, so for EMS, you got to look at what's occurring at the time. Right now, currently, we have supplemental staffing. That first come out of COVID, now it's coming out of reserve. That's to handle the supplemental staffing to address shortages. Over here is the budget request. Those are to fill our vehicles and begin to build a career system and to begin to help and supplement the volunteer services. Currently, there are two separate items. Could they intertwine and overlap? Perhaps, but that's not the direction I have at this time. So that really is where we are. A couple of other positions we've asked for: a quality assurance manager. We've got a number of administrative positions. When the shelter opens, we have a person that's shared between admin and animal control. So somebody's got to go to the shelter, and then we're going to need somebody to backfill that. And we have a CAD technician that's in there. That's a planned position that's been in there since the CAD project was written, so that's in there. And of course, the shelter. And I think that's all of the positions. Any others that I'm missing? Does that sound like it all?
I think so.
So those are all of our positions that we're asking for. And again, that's a request. We'll see if there's enough money to go around and what we get out of all of that. So, so I'll stop there, and if anybody's got any specific questions, I'll be glad to try to answer them.
So the 824,000, is that forecasting that for the year? That's what it would cost if the county took over the program from the services that the gentleman's providing now?
Yes.
Now, does that with benefits and all that kind of type thing, or is that?
So the positions are, there are 15 EMTs hourlies, but that is built off of a certain number of hours, 1,200 hours. So because those are hourlies, there's limited benefits.
Okay.
So, but that's included in there. The medics are full-time, and they would get benefits. There are 6 medics we're looking at. Again, it was intended to build around staffing our vehicles, and then those vehicles would be supplementing what's going on in the county. It in essence, is standing up Company 18, another company. We would probably station that out of our backup center. It's about the only place we got space where we could do that. And but again, let's see where this goes.
Yeah.
These are requests, these are plans, but it's all about, what can be funded, and we'll have to see what.
I'm hoping that figure, to me, it seems low, but
It seems low.
to me,
I think so.
Well, remember,
hoping that's- I'm hoping,
but it is hourlies, and it's a very specific amount of hours to be covered. And remember, it is not intended, this amount of people in this budget cannot cover the supplemental funding. It's not sufficient to do that. It is to add to our, services in the county by putting them in our vehicles and adding to it. So yes, it doesn't seem like
If I may.
much. It's not much, but it is not intended to take the place of all the supplemental staffing that's occurring. Someone else has a question up there.
Yeah, it's me. Just a couple of things. First of all, I think that it's important to point out that we have a meeting that we're working on getting scheduled at the end of the month between Mr. Walker and some other folks from the Department of Emergency Services and the current volunteer EMS leadership to look at what that complexion of our system needs to be moving forward. So, you've got to predict something in order to build a budget. That's what all of us do. So I think, getting too far down in the weeds about the specifics of stuff that's going on right this minute, unless there are some significant changes from commitments that have been made to us about this conversation, then, I think that's a little premature. So I think giving Mr. Walker and his folks credit for pulling this together as an estimate based on, predictions that are murky is a good step. The second thing I would like to point out, and just because of the way Mr. Walker framed it, we have only used the county staffed unit at the vaccination clinic site primarily on 2 occasions. There have been some times when we've had to have some of the contract folks come and help when we've had transport folks, but the vast majority of the vaccination site clinics have been supported by our volunteer EMS service, as has a lot of the vaccination process itself with some of our ALS providers. So just as a point of clarity for that, while we have pulled on some of that resource a little bit, the place where we're really relying on these folks is helping make the rubber meet the road when people are calling 911 and volumes are high, and that's when we're starting to see those folks get out there, and that's a support in the service that we really appreciate.
I got one thing. I'm just concerned, I mean, I know we're talking about it while we're on the issue. I just look at the quality. You know, I think, hiring full-time staff, quality, you're going to get, stable people and retention, and that's just a concern. So I just ask that to.
I will tell you, I absolutely agree. We talked about this at DRSA. I absolutely agree, but it's all about funding. And this is as a stepping stone. Sean talked about this meeting. They would like to have input, and the commissioners will certainly accept any input. And then any decision on funding will be the commissioner's decision. Sure. It's not going to be mine. It's not going to be the RSA's. It will be the elected officials that decides where we go with this. But we accept all input, and it's important to recognize that. But it will be the commissioner's decision whether they accept those recommendations, whether they accept mine. It is the elected officials. But I agree with you. We need quality people, and quality people is going to be full-time that want to come in and get this. We got to start somewhere. Right?
Absolutely.
And we have to establish that we're going to go down that path. This is really intended to get us into moving there. If we can get further along, then we get further along. I hope we do.
Yep.
I would just like to dovetail on that a little bit and say I'd like to believe that we're not trying to present competing visions, but rather we are working together to come up with a unified vision for our system and our community. Because at the end of the day, what matters is that we make sure that the people who need help get it when they need it, and that we are able to expand the services that we are providing with some really creative things that we've talked about for a long time and just not had the resources to get implemented, like some more community-oriented healthcare initiatives and things, in order to make what the people that are our constituents recognize as their experience, a better one here in the county. And I'm also going to say that the most foolish thing that we can do is nickel and dime a rollout like this to death. It is, we are either going to come up with a path that allows us to be supportive of each other and make sure that the people on the receiving end of our services receive consistent professional services regardless of who shows up to answer their call. And we're going to do that in such a way that we suck it up and we find a way to pay for a quality service, or we are going to rightfully earn a really poor reputation for botching this integration. And I would like to see us be a success story. I think all of us want to see us be a success story. And taking the cheapest route is not necessarily going to be the thing that gives us the best outcome for the citizens we're responsible to.
All right, thank you. Is there any other comments?
I find it interesting that, we have fire saying what we've heard from the RSA and the volunteers. So I do think that, the boots on the ground have sort of weighed in, and to Steve's point, it is the commissioner's decision, but it sounds like there's pretty broad support for having a career path and having a full-time service from what I'm hearing. I don't have a dog in the fight, and I don't know that fire has a dog in the fight other than
Right.
these people that are going to respond, and you want the best people.
Absolutely.
So I find that very interesting that, we've had broad-based support for that. So thank you.
And I think that's where we're coming from. I mean, we're support, obviously what you've done the last 2 months, huge change. I mean, I think we've all seen that.
Absolutely.
We've all heard it on the radio. So, and I think we obviously support it. If we need to maybe support it some more, whether it's funding or what have you, then we can only make a recommendation. But, you know, the commissioners do respect what we bring, and ultimately it is their decision. So, but we're here to, just show our support, if anything, so.
Agreed.
Is there any other discussion? If not, we'll move into, if there's any committee reports. I didn't see anything on the agenda, but if anybody has anything. If not, we can move into old business.
There were not. Yep, no committee reports.
Okay, thanks, Sean. In old business, we have CAD replacement update. Steve?
So the RFP went out, and bids have now come in. There's now work being done on technical evaluation, expected within the next week, perhaps two. The evaluation team, which is represented by all of the different facets that are using the CAD, all of them will meet. All of the tech will be given instruction, then we start to do our evaluation. After that evaluation then becomes the demonstration phase. Of course, we have a consultant on hand that has expertise in making sure that what the vendors say they can do, and they're going to demonstrate. So, but the good news is I think it's moving along very nicely. I'm very excited about our next steps. And again, I hope within the next week or two, the teams will begin to review the documents, and we start to make our evaluations and move on. So, yes, the fire department, EMS, sheriff's department, 911 center, we're all involved in this as we move forward. Technology, IT is involved in it. All the components are involved in this. And again, I'm pretty excited about the next step. And then we move on to get to see what it can do. We get to see the demonstrations. So I'm hoping that maybe by summer, we'll start to see some implementation, start to put it together and start building it. I imagine it's going to take us a good 10 months to a year to get it built out. But you know what? When we get it built, we have a product that we want. And again, pretty excited about it. So.
Is there any questions for Steve? All right, if not, the Harris radio systems.
The system's working well. We have a capital improvement program in for a couple of consolettes. These are basically base stations. I think they're a little bit more advanced. Maybe Larry can discuss if you have questions. These consolettes are very important. What they're going to do, they're going to allow our communication center to talk directly to Calvert County on their system, and it's also going to allow us to communicate directly with the Maryland First radio system. So it's critical to our interoperability. I think we're moving along very well. I know Calvert is, and but this is what this specific program is to assist. We've talked about interoperability with the other counties. This is another piece of that. So that's a really good thing. So, but knock on wood, Harris System's working very well, and we seem to be doing well. We are getting ready to begin some preventive maintenance programs on portable radios. I don't know if you want to get into it, Larry, where we are. Yep. So one of the backgrounds on this to know is that when we finished up the Harris Tower system, one of the things that we needed to do was to do preventive maintenance on every portable radio in the county. Well, the benefits of that have been dramatic. They've been outstanding. So we've decided, I've told Larry that we're going to do this every 2 years, and that's what we're beginning to do. If you want to talk about our plan, how we're going to do that.
Plan is to PM all the radios, and I believe, Gary, CP, did you get the email? And JA?
I just saw it, yes.
Okay.
Yeah, but-
I sent emails out with fleet mapping to county fire chief, the president, EMS, same thing. So once the fleet mapping is done, then I have to go back in and redo all of the, what we call personalities, which is programming, and set them all up. And that will be adding Calvert County with, oh my goodness, they got like 5 Hawk group sets. And Maryland First has added what they call an event. which if we have to use the Mail and First side, you'll be switched to an event channel number at that point. But hopefully, we'll never have to worry about that. After that, the PMs are done. Update of the personalities done. Then I also have to come up and actually redo all the voice enunciation with all of the portables, which loading voice in right now is half an hour per portable radio. With the new additions, it's probably going to be 45 minutes per radio, portable radio. Mobile radios, PM is done, upgrade, the personality is done, and that's basically it. It's just going to take a long time.
Larry, if I could, once these radios are touched, is there a capability of us going to OTAP? Updated or?
Well, when you do updates with these, you actually have to touch the radio.
Right.
And I've done OTAP, which is over-the-air programming. I've done that in the past. I'd actually rather be by the radio and watch the radio
I got you.
than do it over the air. One radio is fine, but when you're doing 6 or 8 or 10,
No, I got you.
you can get it done a lot faster when you're with the radio and you see that the radio is done. Because if it does it over the air, it does it the first time. If it doesn't make contact with that radio, it does it the second time. If it doesn't make contact with the second time, it'll go back through the whole fleet of radios and come back and hit it the third time. If it does it the third time, that's it.
Okay. No, totally understand.
So and this is going to take a while. I'm going to try to do it the same exact way I did it last time. I think Jay knows I took spare mobile radios, put them each in units with that unit's identifier. So those radios will be PM'd, put in those units. Portable radios will be swapped out with spares, and we will put the original radio back in once they're PM and updated.
Okay.
So last time, we did identify a number of radios we had to send back to the factory. It was good that we identified all those. And again, I think the benefits of that have been substantial coming back to us, and then again, the system, I think, has been working fairly well. So I think that regular maintenance is important for us to do. Every couple of years, we will do the same thing. So I think it's a good plan.
And we haven't had any issues, as he knocks on wood, out of them for probably 2 years. We haven't had as many issues as we had prior to the PMs done 2 years ago. A lot of complaints on portable radios and issues with them.
There were a lot of different things we identified. The antennas we had on there were not the right ones. So again, we're fortunate. Things are working well. So keep our fingers crossed.
Larry, just a different topic, and it came up in our fireboard meeting. Just, is there any update with the TAC 13 and the issue with the pagers and that programming item that was?
Once we get to all of the pagers again, because we need to do all the pagers and reprogram all the pagers. Once we reprogram all the pagers, then we'll activate TAC 13 again, because children like to play. You key up on TAC 13 on your portable radio, which is something I tried when we first got these pagers. It activates the pager. So people found out that they could PTT up on TAC 13, and everybody's pager around the county would go off.
Right.
Got to take it out of the program when we put it in. So the best thing to do is knock channel 13 off of the air until we get all of the pagers back in, so children don't play anymore.
So when we do that, will they also do, like when we met about extending the length of time that the pager stayed open? Do you remember?
Yeah, I think that was all part of the.
That's all part of
Yeah,
it.
you
It's
got
got to
reprogrammed and
talk.
everything.
So.
Yeah, we've made those changes and we have them saved. It's
Okay.
just the logistics of getting to the stations during a
Gotcha.
COVID event
I
and
understand.
touching everybody's pager and seeing everybody in the department. So we've just been kind of waiting for COVID to go away. The programming, I think, is pretty good, and when we've added those additions that you wanted, and it's working well, it's just getting out to touch everybody's page.
Okay, I understand, sure.
From a fire side. We can talk offline.
Probably.
The pagers
really-
don't have over-the-air
No.
programming, so it's literally you have to come out and touch every pager.
We gather them all up, have time or something. We can talk offline.
Let us consider that.
Yeah, let's
Okay,
talk
we
offline.
might- You might very well be able to help us, so let's see what we can do. I think last time we ended up setting up, 4 or 5 laptops at a time?
Yeah, it was.
So that we could do a bunch, so let us consider that, okay? And we'll look to you and you can assist.
Yes.
Okay.
And the last time we did that, we did it at Company 3
Okay.
on a certain night, correct, Scott?
Yes, sir.
And we were just bombarded. People were standing in line for 45 minutes to an hour to get a pager done. But that was 3, 6, 39,
That's what I'm saying.
4,
Maybe we can do anything
49.
for stations. We could work with you.
Right.
Yes. We can talk about it.
Right.
Yep.
Good news is, these two have found a fix. I'm comfortable with that.
Absolutely.
Now we got to push it out, but it's touching every device in the county. It's going to take some time, but we know it's good. So I'm comfortable that they've come up with a
Whatever
good
we can do to
fix.
make it easier.
Yeah.
Thank you, Larry, appreciate it.
Thank you.
All right, next is our LoSAP update.
I think would be Sean. Sean did some work on
Sean,
that.
yeah,
Yes, thank you. I apologize for the video off and on. I've been having a little bit of technical difficulty this evening. I apologize. As we were running up to the end of 2020, the commissioners asked us at the Emergency Services Board to put together a recommendation for a plan for what we were going to do about awarding LoSAP points to folks for participation in 2020, because we had a really large number of people in our system who, for various reasons due to COVID, were not able to participate to earn the points that were required in order to get LoSAP payouts. There was a lot of question. Mock, as the chair, tasked JA and me and Paula Turner, who is the county's coordinator for LoSAP, with formulating what that plan would look like. So we got together and we talked about that. We pushed that forward to the commissioners after our December meeting, and they took that recommendation and ran with it. As part of that conversation, Jay and Paula and I were looking at other factors of LoSAP that are going to continue to affect us, in part to help improve the utility of LoSAP as a recruitment and retention tool for volunteers in our system, but also recognizing that COVID isn't just going to evaporate overnight. We are going to continue to have folks who have a will to participate, but for various reasons can't participate to the extent that they are accustomed to, and that we are accustomed to, while the state of emergency lasts. Sometimes it's for personal health reasons, sometimes it's for family health reasons, sometimes it's employer pressures, but there's lots of reasons for that. So we looked into 2021 and further. There's a memo that was circulated for the board members. It was also posted out in our board docs, a version of it in our board docs for the December meeting, because we included the whole package in with the 2020 recommendations. We recommend that what the commissioners do for 2021 is award 4 LoSAP points each month to volunteers who can demonstrate that they have a reasonable restriction on their participation during the pandemic response, and let that policy continue through the end of the governor's state of emergency, or the local state of emergency, however they choose to best play that out. The reason for that is that in order to qualify for LoSAP benefits, folks have to earn at least 50 LoSAP points in a year. We give and they have to have no more than 25 of those points in any one given arena. So 4 points a month gives them the lion's share of those 50 points, and still should motivate them to do something like participate in a business meeting, which most of our departments are doing online and making very easy, or in some training activities. I know we've been regularly doing countywide training activities online for the EMS community, and we're actually getting ready to start ramping that up a little bit more again in the very near future. So we felt that 4 points a month, as long as the state of emergency lasts, was a good place to start for padding it out for those folks who have legitimate reasons that they can't. We also felt that it was important that it be explicit that now that vaccination is available, and we have worked really hard to make vaccination available to the folks in the fire and EMS community, that there needed to be documentation of a continued need for a limitation of volunteer service from folks who have been able to take advantage of that vaccination process. We explicitly considered the fact that, again, an individual's physician might encourage them not to participate because of personal health risk. They might not be able to because of family members or a dependent's health needs, and for a lot of our folks, actually employers. On a side note to that, after we had this conversation, in one of the COVID coordinating meetings, one of our commissioners, Commissioner Colvin, actually reached out to the command on the base, and the base command has assured him that there is no current restriction globally on PACs for folks not to participate in volunteer service just because of COVID. There are some commands, however, that are that do have some restrictions because of mission critical stuff. So anybody who sees this, check with your command and make sure that they're not willing to give you a waiver on, the orders that came out in March. Now that we're seeing some changes in our local conditions. We also looked at how the county pays out LoSAP awards, and we compared them to what a lot of the other jurisdictions in the state are doing. We leaned really heavily on the program in Anne Arundel County, actually, for a lot of the stuff that we recommended here. There were a couple of things that we recognized. One was that folks who start young don't really see a LoSAP benefit under the current structure for a really long time. As an example, I can't draw LoSAP benefits even though I have been an active participant in our volunteer service for 31 years because I'm not old enough, because I started on my 16th birthday. So, and there are a lot of folks who are in a similar boat with that. So we made a recommendation that for folks who have reached the age of 46 with at least 30 years of service, which would be folks in that same situation, recommending $150 monthly base payout with the $10 additional for each year of service after that 30 years. For folks who have reached the age of 55 with at least 20 years of service at $300 a month. Folks who have reached 60 with at least 20 years of service at $400, and folks who are 70 with at least 3 years of service at $150, and explicitly paying out what would be the highest available for folks at each of those levels. And the reason for that explicitness about 70 is we recognized that our system attracts, especially on the EMS side, we attract a lot of retirees. So folks who are 65 when they enter into the system, and who are just plain never going to be able to participate long enough to make a benefit that requires 20 years of participation. However, these are folks who are valuable contributors, and so we felt like that would be a good tool to use for them. We also discussed using a tiered LoSAP system, which we did not get into the details of because I think it's something that needs to be a broader conversation, and so we didn't want to get too far down in the weeds with it. But using a little bit of a tiered LoSAP system to consider giving volunteers access, for instance, to the county's health insurance plan, not free health insurance, but access to buy into the county's health insurance plan, to property tax incentives, which is a thing that we've actually had some discussions about before, and perks like free landfill access, and maybe even considering like open access gift cards for folks who make certain amounts of points in a month and things like that. These are just some of the things that we kind of spitballed around, and we included here as an opening for, hey, can we talk about these kinds of things with the folks in the government to see how feasible they think it is. I know that there are some other ideas. I know that there are some other things that are going to occur to folks as far as expanding what we can do with those benefits. And I know that there was a little bit of a conversation about things like death benefits and line of duty deaths and things like that that we hadn't talked about yet. So that is the package of stuff that we put together and we bring here today to consider forwarding to the commissioners.
All right, thank you. Is there any discussion?
So I just want to add just a couple points for Sean. So, in looking across the, he mentioned Anne Arundel, in looking across the state, there's 21 counties that participate in a program like this. 15 are already higher than us, that have been higher than us for years. 5 of them are still going to be higher than us if we were to get what we're asking for. I mean, so what we're asking for is not crazy. It's not some crazy high number that's going to pay. We're not getting rich off this. This is truly it's an incentive program to keep the the volunteers volunteering. And I listened to the commissioners meeting last week, and I think they recognize that there needs to be some incentives to keep the volunteer system afloat for the long term, and I would hope that they would recognize this as one of those things, and I think mentioned in there, and we can get into the property tax incentive, a little bit more in detail. I'd like to, just because there's a new Senate bill that Senator Bailey's introducing. I think it just got read on the House floor last week or very recently, to make sure that EMTs are included, volunteer EMTs are included in the people eligible to get the property tax incentive. And that is up to $2,500 property tax incentive. We've been down the road before. It didn't get approved. And I would hope that that's something that the commissioners would reevaluate and look at, because what I see is the retention for volunteers that are 25 to 40 years old. That's where we're losing people. They're starting a family. They're buying a house. They've got to work 2 jobs. They just can't do it. They can't afford to spend their time in the volunteer firehouses or EMS stations because they just don't have the ability to do it. And they need a paycheck more than they need to come volunteer. So, I hope that we get some support behind this. I think this is it would be a great change for many reasons, in my opinion. And, I hope that it gets some push when it goes to the commissioners. So.
Now, is this a document that we're sending? You can concurrence to move now?
If the board decides and votes to push this forward, then yes, we'd be submitting a letter.
Why would we not go ahead and place the line of duty death or death benefits in this? Would that be something we should consider?
I wouldn't have an issue amending it, Sean. I don't know if we can meet. I looked at some of the others, and CP and I just really talked about it tonight. But I would definitely think we could include that in there and then send it to them. I think we can make a motion with that included.
I don't see any reason not to do that.
Okay. Is there a motion to move forward?
So I move to approve and forward the letter to the CSMC requesting implementations of the LoSAP recommendations to also include the death benefit that the committee will
I'll second it.
include.
All right. So we have a motion by Jay, second by Dr. Gary, to push forward the recommendation for the low SAP increase and also include the death benefit in the document. Is there any other questions? All those in favor?
Aye.
Aye.
Opposed?
Aye.
All right.
Aye.
Thank you. All right, moving into new business. Annual report. Sean, do you want to fill us in on that?
Sure. As has been the habit, with a huge amount of support from our staff, Marianne and Angela in particular, and Darlene, welcome to the team. Thank you. The annual report for the Emergency Services Board was sent out last week to the members for posting. Just to hit a couple of the highlights, the report does cover the purpose of the report. As usual, it's the boilerplate opening. It lists the 2020 members because it is the 2020 annual report. So that change the change in membership that we have for this year will be reflected in next year's annual report. The schedule of our meetings is included, as well as the statistics on attendance for the meetings for the year 2020 and our special meetings and the elections that we had in December. And I noted after this got sent out, actually, there is a typo on the in the report for the year. I neglected to change the year when I changed the date for the December meeting. So whatever, when we approve, we need to approve it as amended with the year correction on that. The section on education and training outlines the applicants for from the fire and rescue community who received awards under the scholarship program. And discusses the modifications to training and the local training efforts that we have done under the COVID restrictions that we have, as well as the work that we've done to support the recertification processes for all of our personnel. The budget and finance section discusses the fund payments that we made and the loan applications that we supported for the folks at 2nd District Volunteer Fire Department and Rescue Squad, as well as the grant that we co-signed for the nice folks at Ridge Fire Department back in October. It also discusses the previous version of the LoSAP award that we talked about just prior to this. The section on support services and coordination discusses our role in the transition that we're going through with the integration of support services for EMS, as well as the planning for that moving forward. The legislative recommendations looks at the structural changes that we've looked at that are necessary to be able to manage EMS billing internally, and let's see. So there's a new section in the report this year that was actually omitted from the 2019 report. The emergency services system activities section outlines the things that we have done in support of our community over the year 2020. So it includes a brief discussion about the impact that COVID has had on our systems and the things that we have done to overcome the negative impact of that, as well as the things that our volunteer fire and emergency medical services personnel have done in support of programs like the testing and vaccination processes for St. Mary's County. And as a total side note and a very personal note, this is one of the things that I am most proud of that we have pulled off in our emergency medical services system, is the support that we have been able to offer our partners at the health department in both testing and vaccination for folks during the COVID crisis. And I'm going to take that opportunity to give a super shout out to Dr. Mina Brewster and the staff at the health department for the amount of leadership that they've provided and coordination that they've put into pulling off what really is a Herculean effort and a huge lift. So the closer just outlines again restates the role of the committee. Of the Emergency Services Board in our community, and reasserts our commitment to continuing to support and bolster the emergency services that are provided in the community. I'm going to read this last paragraph. The Emergency Services Board and the first responder community we represent remain committed to serving the citizens of our community. The Emergency Services Board does this by advising the commissioners of St. Mary's County on fire and EMS service matters. As the world has struggled through 2020, so did St. Mary's County. While there have certainly been trials for our community and our services during the last year, and while the challenges we face will continue for some time, the goal of providing the best possible emergency services in the best possible way to the citizens and visitors in St. Mary's County is always the priority for the Emergency Services Board, volunteers in the first responder community, the Department of Emergency Services, and the government of St. Mary's County as a whole. We remain dedicated to the people we serve. And that is how the report closes.
Very nice.
Yep. Good report. Thank you, Sean, for putting that together for us.
I move to approve the 2020 annual report for the Emergency Services Board as presented.
Second.
All right, I have a motion by Jay, second by CP to approve the 2020 annual report. All those in favor?
Aye.
Aye.
Opposed?
Aye.
Thank you. Mary Ann, going back to the other, on the LoSAP, Steve seconded, not Dr. Gary. If you make, okay, thank you.
Thank you.
All right, so next on our agenda is the emergency service report.
So the emergency service report, what we're really focusing on is the COVID response, and Sean has talked about quite a bit of that. So certainly the volunteers, particularly EMS, have done an outstanding job helping the health department. We're over there in the midst of that. Mark Pettit, who has helped to set up the parking lot and coordinate all of the way that goes. It's been a phenomenal job, but the COVID obviously has taken our focus in this past year. We're still meeting weekly. We were doing it twice. We just got back to one. But again, quite a lot of our resources are focusing on COVID. EMS supplemental as a result of COVID. So if you think about the last year, it really is a challenge, continues to be a challenge. What Sean just closed on is exactly the point of it. We are here to serve the public, to focus on getting help to the people that need it. But that's really, the main focus. I mean, I could get into all the different things we do, but COVID has been our focus. So if you guys got any questions about anything we've done in the last year, we'll be glad to help you out.
I just want to say, great job. I'm there at Hollywood, and I see, I'm telling you, phenomenal job that everybody's doing to get these vaccinations done and leading the state. So I think we got a lot to be proud of.
We really do. It's outstanding. So today they did about 1,250 because they were closing some because of the impending weather. So they doubled up. And I've got it on my screen in my office. I watch it as it goes through and it was incredible how many they had, but they were moving them through, getting them done. It's the only way we're going to get through this.
It was a very long, very chilly day.
It was, but it was incredible. And by 3:30, 3:45, it was done. They had used all of that. Incredible job. Incredible. Hats off to Dr. Brewster and all of the people that are involved in this. Sean, Emergency Services, Sheriff's Department, who's there. There's so many different pieces to this. It's a great job. It really is. So.
Yeah, thank you guys. Like I said, it has been phenomenal. I think the only thing that's holding us back is just getting enough vaccinations to.
That's right.
Yes.
To get to our citizens. So, but you guys have done a great job. So, I know we're all appreciative of that. So next on the agenda is the special elections. Mock has decided to, or has stepped down from the board with the Rescue Association. So we need to elect a new chairperson and vice chairperson. I know I've put myself out there. I would be willing to do the chairperson. I don't know if there's someone that's willing to do vice chairperson or would be willing to.
Well, so as a point of clarity, the Ambulance and Rescue Squad Association officers' terms end at the end of December, and so Mock's term of obligation to us at the association for representing us on the board here was up. And one of the things that I think we need to make sure we have clarified going forward is that it's in the February meeting, our first meeting of the new year, that here we should be regularly conducting our elections. Because we do have those transitions that happen in November and the end of December for the Fire Board and the Ambulance and Rescue Squad Association. So we don't really have everybody who's going to be seated on the board until this meeting for the first time.
Sean,
So that having been said,
do you want to nominate Gary for chair?
yeah, I'm getting there. I have a weird audio lag. I'm sorry. So I actually, that was my next thing. It was to nominate Carrie Bell for chair of the Emergency Services Board.
Do we need to have the motion to enter into the special election before we do that?
I think we do, actually.
Okay.
Oh, probably.
All right, so I'll move to enter into a special election to replace the chairperson of the Emergency Services Board for the year 2021.
I'll second.
I second.
All right.
Did you say the chairperson?
I can have it.
Yeah.
You want to amend that to do both the chair?
Well, there's a second motion. Okay, I'll move to enter into a special election also for the vice chair of the Emergency Services Board for 2021. I'm just reading what's on the screen.
Second that.
All right. So we have a motion by Jay, second by Steve, to enter into the special election for the chair and the vice chair. All those in favor?
Aye.
Opposed?
Aye.
Aye.
Thank you. Okay.
So for chair, are there any nominations?
Make a motion.
Gary.
Gary Bell.
Yep.
Sounds like a second. Okay.
I second.
So got a motion by CP and who was the second?
Or a motion by Sean, either way.
I think it's Sean.
Sean. Second by Sean,
All good.
Who was the motion by?
CP. To enter myself as the chair. All right, all those in favor?
Aye.
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 Opposed? All right. All right. Is there a vice chair?
I nominate CP.
Nick. I think,
Yeah. Was there anyone else, Sean, that had interest? Do you know? I'll second the nomination if there wasn't.
anybody else want it? That's my main thing. I don't mind it.
I
Nominating
was
Hattie
going to.
Norris.
Okay.
Say that again.
So Hattie? Is that-
On balance, I mean.
Is that right?
It'd be nice to have, I mean, Hattie, are you saying you're interested, that you'd accept if nominated?
I can't tell who's talking.
Yeah, no.
I would accept.
Okay.
Now we have.
Now I would like to rescind,
Sorry, Hattie.
rescind your motion and then,
Yeah.
I will rescind my motion.
thank you.
Okay.
Now we're good.
All right, so is there a motion for Hattie?
I'll make a motion for Hattie.
Second.
All right, motion by Steve, second by CP to nominate Hattie for the office of vice chair. All those in favor?
Aye.
Opposed?
Aye.
Aye.
The ayes have it, so ordered.
Sorry, Hattie. Great choice.
All right.
Thank you.
All right, thank you. Next is the 508 AMOS funding.
Okay, so the 508 Amos, so just a little thing to read. Senator William Amos Fire Rescue and Ambulance Fund. So that was after Senator William Amos. So money's provided by the state of Maryland to volunteer fire rescue companies for the acquisition, rehabilitation of fire rescue equipment, facilities, primarily used to house such equipment. Distribution of AMOS is based on the ratio of the number of county property tax accounts to the total number of property tax accounts in the state of Maryland. So there's a specific formula, reminds me of the old state aid for police funding, very similar, very interesting, and I was just asking Marianne to come up with some numbers for me. So when you look at what was reported by our financial officer to the state, so our expenditures, net county expenditures, for gross county fire protection expenditures, fire protection means, of course, fire and EMS and all of that for public safety, and incredibly $9.1 million. Now, that formula, and that's what we get from the state every year is about $306,000. Gerald reported to me, I texted him, he said about $18,000 for each organization, fire and rescue. So it's about $150,000 for fire, $150,000 for rescue from the AMOS fund. And of course, we received that, but that's the report on it. And if you ask questions, I'll try to understand it and answer it. But it's basically state aid for fire and EMS, and we've received it, and we do every year. So that's my report.
All right. Is there any questions? If not, there's any other new business? All right, we'll move into board member time. Is there any comments by board members?
So the commissioners, they do an annual recognition of board members, and I've got a couple of them here. I have actually, for all the board members, of course, many are not in attendance, and we will get those to those members. But the couple that I've got here,
Thank you, sir.
from the commissioners of
Thank
St.
you.
Mary's County.
Thanks, Steve.
And again, I've got all the rest, the ones that couldn't attend tonight. One for you, Sean, one for Rocky, and a few others. But we'll get those out to people. And again, thank you for your service on the board.
Thank you, Steve. All right, any other board member comments or?
Only thing I, Gary, so just another Senate bill that Senator Bailey introduced, I just wanted to make comment on, just thank him for doing that. So there's a one in for Senate Bill 99 for makes it a hate crime for any crime committed against a law enforcement officer or first responder. First responders are included in that. So I know it's had its first hearing. Hopefully that goes through and makes its way, but that's a pretty good bill that, toughens the penalty for anything that's committed against us while we're trying to do our job, so.
Certainly do thank Senator Bailey for his support. Is there any other board member time? Hearing none, Chair entertain a motion to adjourn.
Make a motion to adjourn?
Second.
Motion by CP, second by Jay to adjourn. All those in favor?
Aye.
Hey.
All right, thank you, guys, and that'll conclude our meeting.